Hi, I'm Dr. Rachel Goldstein, and I'm a plastic surgeon at the Crane Center, practicing exclusively in Boulder, Colorado. And I'm here to talk about abdominal phalloplasty. What is abdominal phalloplasty? So, abdominal phalloplasty is the creation of the phallus using donor tissue from the lower abdomen. So, between the umbilicus, the belly button, and the pubic bone, that's where we get the skin and soft tissue to make the phallus. The abdominal phallus itself is just the creation of the outer tube, and then we can create the urethra and do urethral lengthening in a different stage procedure. How is this procedure done and what does it look like? The abdominal phallus is created by a flap of tissue that's designed between the belly button and the pubic bone. We take that flap of tissue, which is based on the superficial epigastric arteries, and we fold them down and then create a tube to create the phallus. Sometimes we can't find those vessels and it's on a random pattern of blood supply, but most of the time we try to base it on those blood vessels. Then after we fold down the phallus, we'll have a missing space, which is the donor site on the abdomen. So we create two flaps on either side on the abdomen that are supplied by blood vessels, also the superficial circumflex iliac arteries, and we fold them down to close the donor space. What you get is a scar that's shaped sort of like a sideways H with dog ears in 4 places that we can revise later. What goals can be achieved with abdominal phalloplasty? Well, this is the same as for any other donor site phalloplasty, like radial forearm or ALT. You can achieve the goals of standing to urinate, of having penetrative intercourse. You can have a scrotoplasty. You can have urethral lengthening. You can have a nerve hookup as well. The nerve hookup is just done a little bit differently. The abdominal phallus does usually have sensation, although not to the full length of the phallus for everybody. It just sort of depends on how you heal. But one way that we do the nerve hookup is when we do the urethral lengthening, and we do the radial forearm free flap urethroplasty. At that point, when we create the urethra as the inner tube of the abdominal phallus, we can hook up the nerve to the clitoral nerve at that stage, and then you'll have full sensation to the end of your phallus. What are the stages? The first stage is the abdominal phalloplasty only, so just creation of that abdominal phallus. So as we described, it's taking those abdominal flaps, creating the outer tube, and then closing the donor site. After that, sometimes some patients need to have a debulking or a scar revision before we can move on to the urethral lengthening stage, but it sort of depends on you and how you heal. After that, we can do the urethral lengthening after everything is completely healed up, which is about 6 months. The urethral lengthening, as I mentioned before, requires a radial forearm free flap. Instead of taking the entire radial forearm to create a urethra, we only need a 4-centimeter strip right here on the forearm. We then take that with the artery and veins that give it life and connect it to the blood vessels in your abdomen. We open up the abdominal phallus like a hot dog bun, and we put that radial forearm free flap tube, which is the new urethra, like a hot dog in the bun, close up the abdominal phallus over it, and then we hook up that radial forearm free flap urethra or hot dog, which is your new urethra, to your native urethra, and that's how we do urethral lengthening. At that stage, we also, as I mentioned, do the nerve hookup. That'll help give you sensation all the way to the end of the phallus if you don't have it already from your abdominal phalloplasty. And we can do a vaginectomy and scrotoplasty at the same time. Some patients may also elect to have their vaginectomy done at the initial stage with the abdominal phalloplasty, which is something that we can absolutely do and helps with our urethral lengthening later if we take care of it at the initial stage. Other stages that are done include dog ear revision. So the dog ear revisions can be done partially during the urethral lengthening and nerve hookup stage, but can also be done at future stages, including the glandsplasty stage and when you get your testicular and penile implants. Who can have an abdominal phalloplasty? The success of an abdominal phalloplasty really, really strongly depends on patient selection. As far as all different types of phalloplasty, it's the most important for abdominal phalloplasty. So some people think, oh, the more tissue I have, the better it'll be. If I have a lot of donor tissue, I'll have a great phallus. That's not really the case. More tissue is not necessarily better. If you have too much fat tissue on your lower abdomen, we won't be able to close the phallus, and it'll have to be left open. You'll have a lot of scarring and scar contractures, and you won't have a good aesthetic or functional result. So it's very important to have the perfect anatomy for an abdominal phalloplasty. We like to say the BMI ideally should be around 28 or below, but BMI is just a reference. It's all relative. People carry their weight in different places. And so if you have a BMI over 28, it doesn't necessarily mean abdominal phalloplasty is not for you. It's just a guide. It really depends on the distribution of fat and in your lower abdomen and how your lower abdomen looks. So you usually will be asked to send pictures in before your consultation so we can see. Some patients have transverse scars or scars going across their lower abdomen from a hysterectomy or from another procedure. Patients that have this, they might have compromised blood supply. The blood supply that goes to the flap might have been cut in the original surgery. That's not always the case, and we can always do a CAT scan to see if that superficial epigastric artery and vein are present. But if you do have a scar, then you may or may not be able to have an abdominal phalloplasty. Also, some patients have a crease between their pubic bone and their belly button where their belly kind of hangs over. If you do have that, then that crease will translate to the phallus, and it might have a suboptimal aesthetic result. So if you have a really strong crease there in your lower abdomen, you might not be a good candidate for an abdominal phalloplasty. Again, all of this is evaluated on a case-by-case basis. It's very personal and different for each patient. And so you might be asked to send pictures in before your consultation to see if abdominal phalloplasty is right for you. What are the pros of abdominal phalloplasty? So one of the biggest pros is the donor site. So the lower abdomen as a donor site can be a little easier to hide for some people. You can hide it under your shirt. It's not as obvious. And the divot that's created by taking a radial forearm tissue or ALT tissue from the thigh, it's not present with the abdominal phalloplasty because we're using flaps from your abdomen to close the donor site. So the contour doesn't change too much. You have a minimal risk of loss of function from the donor site. So some people are worried about having a problem with function of their arm or their leg after radial forearm or ALT phalloplasty. With abdominal phalloplasty, you shouldn't have any loss of function. Also, there's actually some degree of body contouring done for some people. So if you've had massive weight loss and you don't have any excess fat, just some excess skin in your lower abdomen, it's kind of killing two birds with one stone. We can make the abdominal phallus, and then instead of closing the donor site with two flaps, we can just pull down the tissue from your upper abdomen, and it's kind of like doing an abdominoplasty or a tummy tuck. That's in rare circumstances and only for certain patients, but for some of these patients, it's an added benefit. There's less morbidity of urethral lengthening from the radial forearm donor site. So as I mentioned, we do need to use the radial forearm for the urethra, but you don't need to take all of the tissue all the way around. You don't need to use tissue from this part of your arm, just a 4-centimeter strip. And you will have a skin graft here, but it's a little easier to hide, and it's a lot less morbidity from the donor site. Hair removal is not required prior to the abdominal phalloplasty. You don't have to remove hair from your abdomen. You can. Some patients choose to remove their hair before we create the abdominal phallus. That's a personal choice. You can do hair removal after we create the abdominal phallus. But if you want to just start moving ahead with your surgery because there are so many stages and you don't want to wait for hair removal on your lower abdomen, you don't have to do it. We can create a phallus. Whatever hair is on your lower abdomen will be on your phallus, but you can choose whether or not to remove that. However, you will have to remove hair from the radial forearm before we do the urethral lengthening, but you can start doing that around when we start doing the abdominal phallus stage. What are the cons of abdominal phalloplasty? So as far as the donor site goes, even though there's no divot like there is in the radial forearm or the ALT, there are significant scars. There is an H-shaped scar. You will have dog ears that are temporary, and we'll revise them, but there are significant scars in the lower abdomen, and you can have a lot of scar widening. That's a common scar pattern in patients who have had abdominal phalloplasty. You do have to have multiple stages of the procedure. So radial forearm and ALT, we can create the phallus and do the urethral lengthening on the same stage. For the abdominal phalloplasty, it's one added stage in that you have to do the abdominal phalloplasty first. And then again, for some patients, you may have to have a debulking stage before we do the urethral lengthening stage. This surgery has a very high risk of wound healing problems. That includes both on the phallus and on the abdomen. So that's something to keep in mind, and it can lead to adverse scarring, and sometimes that has to be revised before we move to the next stage. There is a decent risk of flap loss, and that just depends on the blood supply to your abdomen. It's hard to predict. We do measures within the operating room to see if there is areas of flap compromise, and we're able to cut away those areas if we are able to identify them in the operating room. So that sort of mitigates that risk. The other thing is that sensation is not guaranteed. There's no named nerve that follows the distribution of the phallus that we're creating. Again, most patients say that they do have sensation to their phallus. Not everyone has sensation all the way to the tip, but again, we can fix that with the radial forearm urethra. We will hook up the radial forearm urethra to the clitoral nerve, and then you'll have sensation. So at least you'll have sensation of where your phallus is in space, and most people are very happy with that. The other thing is that the abdominal phallus could sit a little bit high, and that really depends on your anatomy. We do everything we can to push it down low, but if it sits a little high, then we might have to do another procedure to lower it down, and that depends on how things heal up. So during your recovery process, we'll ask you to sort of move the phallus up and down to help encourage it to stay in a lower position and prevent it from contracting upward. What are other risks of abdominal phalloplasty? So in addition to the risks that I just mentioned, risks with every surgery include bleeding and infection. We'll give you antibiotics to prevent infection, and bleeding does happen, including hematomas that can result in a return back to the operating room, and that's just with every operation. Another risk is unacceptable cosmetic appearance after wound healing problems, especially. You may have lost some wound healing problems at the phallus and of the abdomen, as I mentioned. Also, just keep in mind some patients, the tissue bulk is a little bit greater than we anticipate on their lower abdomen. And so when we close the phallus, we aren't able to close it all the way. Sometimes it's just too tight, and if we close it all the way, it'll choke off its own blood supply. So we have to leave it partially open. If this happens, you'll have to do dressing changes. So you have to be prepared to be able to do those dressing changes, and not be someone who is not good with wound care going into it, because occasionally we may ask you to do some dressing changes if we have to leave your phallus open. It may require additional procedures. If you do have wound healing problems, or we do leave your phallus open, it will create a scar, and then you could have scar contractures that we'd have to do some releases. Sometimes we have to debulk the phallus in order to be able to fit the urethra inside the phallus, and again, to make room for the hot dog to fit inside the hot dog bun. It's just simple as that. Unless you don't want to have urethral lengthening, or you don't want to have a debulking. It's a personal choice, and not everyone has to have it. If you don't have a lot of tissue in your lower abdomen, then you might not have to have debulking. And then the other thing is a risk of blood clots in your leg that can travel to your lung. That's a risk with every surgery, but in this type of abdominal operation that we're doing, the risk can be a little bit more elevated. And so we may ask you to take blood thinning medication in the form of an injection for about 10 days after surgery to prevent those blood clots. Postoperative recovery. A unique thing about recovering from this operation is that you'll have to be sort of hunched over for 1 to 2 weeks. When we close the donor site between the belly button and the pubic bone, we have to pull tissue down. We create those flaps on either side to close the donor site, but we also have to pull tissue down. Sometimes we have to cut around your belly button and pull tissue from the upper abdomen down. And we do that by flexing the bed like this in the operating room while you're asleep. And so when you wake up, you're going to have to stay hunched over when you're walking, and you might not be able to lie flat, or you won't be able to lie flat for up to 2 weeks until everything is healed up. Then we'll allow you to start standing up, and we'll start lying flat once the tissues are healing and everything is sort of relaxing. You won't be able to do any heavy lifting for up to 6 weeks. And then you'll have to sort of keep your phallus elevated to prevent swelling from swelling accumulating from the tip. Especially with this type of phalloplasty, swelling can really accumulate at the tip, and it can create this oblong shape. So we have to keep the phallus elevated to allow drainage of fluid and prevent swelling from happening. Well, I'll also ask you to move your phallus up and down after about 10 days to make sure, as we talked about, that the scar doesn't form and cause the phallus to ride up. So we'll want you to move the phallus up and down after about 10 days to prevent those contractures. And if you are someone that has a lot of swelling for whatever reason, I may ask you to wrap your phallus for about 3 weeks to prevent swelling. Other than that, how much time you'll have to take off of work depends sort of on what you do for work and what sort of physical requirements you have, and we can discuss that personally. But usually I tell people to take off about 10 days after the surgery. 10 days to 2 weeks is a good time estimate. Takeaways. Abdominal phalloplasty is a great option. It offers a attractive donor site that's not the forearm and it's not the leg, and it can be a lot easier to hide for many patients. You can still achieve the same goals as you can for other phalloplasty donor sites, such as standing to urinate, penetrative intercourse, etc. But good results do require very careful patient selection. So it's not for everybody, but if it is for you, then I think it can have a really, really nice result, and I believe in this technique for phalloplasty. So if you're interested in abdominal phalloplasty, again, I'm Dr. Rachel Goldstein for the Crane Center in Boulder, Colorado. And if you are interested in abdominal phalloplasty, please schedule a consultation with me. You might be asked to send in pictures so we can discuss different phalloplasty techniques and whether abdominal phalloplasty is right for you. Hope to see you soon in Boulder.